was thinking maybe just doing a healthcare provider thing just based on motivational interviewing.
Okay.
And I know you know a lot about it already. In fact, you do a lot of those principles on your own. I don't know if you finished your training yet.
I haven't finished my training.
Have you started it?
I haven't started my training.
What do you mean you haven't started it? What do you mean?
I'm
you were supposed to start it months ago.
I'm 3 weeks behind in an 8-week program, which is I'm so embarrassed of it. So I've heard the name Bill Miller about, I don't know, 800 times?
Well, I say it every time I talk about motivation.
Every time you talk about Bill. And so that now I see he's in these videos.
Oh,
right?
you see his face.
Oh, yeah, he's talking.
Yeah.
And he's actually, I don't know, is he still alive?
Yeah.
Okay, he's still alive. But he's not,
so.
he's not a, I figured he was like a Freud type character.
God, he's not a god.
But I just figured this guy's been dead for 50 years and he's like 120. But no, this is just a regular guy.
He's like in his 60s or 70s.
Yeah. So and he's wearing the kind of the New Mexico look and and it's very insightful, right? So I'm just starting that and I honestly, as foolish as this sounds, I didn't know that kind of this is all I've gotten to is kind of the stages of change being kind of intermingled into that motivational interviewing. Yeah. So I because I've always learned about the stages of change in motivational interviewing separately. I don't know if are they integral to each other?
They have common themes.
Okay.
But currently in motivational interviewing, we stay away from the stages of change. And I can talk a little bit about why that is. And we could even talk about why the stages of change is sometimes not a good thing in a clinical setting to think that way.
Okay.
Right? And I think that's going to be but I mean, it'd be better to start where those questions are. I mean, I love the fact that you've seen him. And the way that he presents himself, I think it's done with intention. So every time I've seen him give a talk, he always shares a learning story where he learned something he didn't know. He always talks about cases that were particularly tough for him to do. And I'm convinced the reason that he does that is because he wants everyone in the audience to realize they can become as good as he is.
Yeah, so he's not holding in that information. So I know there's other programs or philosophies, maybe not at your level, but in my level. I don't know if you've heard of RAP, wellness
recovery action plan or something.
There you go, you got
it. Oh, okay.
So and Mary Ellen Copeland, I think is her name.
Good for you. You're gonna be name dropping left and right, just like me.
Well, so I've taken a lot of those courses and gotten those certifications, but I felt that learning module was, how do you say, sort of closed in or proprietary a little bit, because it's like you got to learn the way that they want you to learn.
Yep.
And you got to sign up for their courses. You got to sign up for this book and that teaching module and that, and it's kind of rather expensive actually, considering what it. Not that it's not a good value. But I feel that the motivational interview is a much more loose, open source, I guess.
Yeah, and a lot of it is because of how it was developed and what the philosophy is, right? So if you look at a lot of these psychotherapies, the psychotherapies of today are structured, they're time limited, they have a start point, they have an end point, and a lot of people put together these packages and they put them in studies and then they keep ownership of it, right? So they get money from the books, they get money from the training, all that kind of stuff. The way motivational interviewing developed, so Bill Miller, I find you can learn a lot about a psychotherapy when you learn about where the person who developed it trained and also how they trained. And so Bill Miller was very heavily trained in psychoanalytic and psychodynamic, which is more sort of about the person in depth, right? It's a bit complicated, but it's more like that old school stuff, like Freudian-ish stuff. But he was also very heavily influenced by this guy named Carl Rogers.
Okay.
And Carl Rogers, he's all about unconditional positive regard. So if you see and treat the person the way that they can be and could be, and like they will become that way. And his whole philosophy is really based on seeing that good in others, seeing the greatness in others, and nurturing that greatness. And so sometime in the 80s, he wrote this paper on what he called motivational interviewing, but really he was just...
This is Carl Rogers or Bill Miller?
No, this is Bill Miller.
Okay.
And it's good that you ask these questions, right? Because I jumbled this stuff up together. So Bill Miller, influenced by psychodynamic, psychoanalytic, trained in New Mexico, very influenced by Carl Rogers, and it was around the time that AA was very prominent.
Okay.
And when you think about AA, it's a very different philosophy, right? So what do they say in AA? They have a certain number of steps. You go to meetings, and you're powerless. You're powerless to this addiction.
Yep.
And you need like a sponsor. You have to go through the steps to get better.
Can't do it on your own.
Yeah, and it's done wonders for some people.
It has.
Right? It absolutely has, you know, and when you think about the social community, the connection,
100%.
all that kind of stuff.
Yeah.
And so in that environment that Bill Miller was in, back then, if you wanted to go into a treatment program, they had these places, you'd show up at like maybe 7 a.m. or something, you'd wait in line for about an hour, and they would take 6 or 7 of you into this program. You'd always be waiting in the sun because it was in Arizona, and then you'd have to go through a full day assessment to get into one of these 12-step long-term programs.
Yeah.
And so I suspect, I don't know if this is true, he created this therapy for those where the existing programs didn't work. And so he wrote a paper in the 80s and he forgot about it because he's a therapist, he's a clinician. And then the other guy, Rolnick, I don't know if he was from Australia or New Zealand, he was from one of those two countries.
One of those Kiwi type places.
Well, you learn how ignorant I am right now. And so he read this guy's stuff and he ran into Bill Miller at a conference and was like, oh my God, I've been doing your motivational interviewing. And it was like, what? What do you mean? And he didn't even remember that he wrote this paper. But no, like, so basically this Rolnick guy got so excited about this. I think he was an Emerdoc, I'm not sure. Maybe he was a therapist. I can't even remember his story. But he got so excited about it, he started doing what was based on this one random paper this guy wrote that he'd forgotten about it. And then what happened with MI is because the spirit is really, really about acceptance. It's about promoting individual autonomy. It's about a partnership, co-developing. It's not about me, the expert, telling you. It's about this creation of this experience. And what happened was there was this organization that was slowly developed, the Motivational Interviewing Network of Trainers. Bill Miller and Rolnick wrote about 3 editions of the book, and each edition would keep getting adapted based on what this community was developing and evolving.
Okay, let's back up in this story a little bit. Okay, so Bill Miller wrote this paper sometime before it kind of took off.
Yeah, like around the 80s sometime.
Okay, and then he found this family medicine kind of guy.
Yeah, he might have been a
somewhere
family
from-
doctor. He might have been a family
He's a
doctor.
physician of some sort.
He might even be a physician. He might be a therapist. That's how horrible
He's a
my memory is.
healthcare provider.
Of some sort.
And he's somewhere in the in the Australia New Zealand area, right?
Oh, God.
Okay. So, but then did that sort of reunite the kind of interest for Bill Miller himself back into this program?
Yeah, that's why they wrote the first book.
Oh, okay.
So that's when they wrote the first edition of Motivational
Okay.
Interviewing. They got all excited. They started talking the way we are now, and oh my God, it's so helpful.
Okay.
And then they did their first book.
Okay.
And then this movement started to develop, right? Because what do you do for those people that don't like being told what to do? Like, you see their problem, like, hey, you got to do this. This is not working. You're killing yourself. And they're like, fuck off. Leave me alone. And so you need something to hook them in. And so they protocolized it. They evaluated, and they got a whole bunch of scientists and therapists to try to develop it and improve it and evolve it. And so when it started, they were using the stages of change kind of approach, but eventually they've really moved away from it.
Right.
Right?
So they seem to have moved, like it sounds like what you describe also just sounds exactly like harm reduction, right? Which is meeting somebody where they're at and accepting it and normalizing it.
Yeah, I mean, I think harm reduction is a little bit more nuanced because for a lot of these cases, you're literally sharing or providing a service, whereas motivational interviewing is a tool of language. It's a tool of language where you use certain words a certain way, and you get a response a certain way. But there's definitely an overlap, and that's why they're really good partners, right? In terms of interacting with people.
So the first guy, this Carl Rocher, was it Rocher?
Rogers.
Carl Rogers. Is he dead?
I think so. I think so.
May he rest in peace.
He was a phenomenal. He was a phenomenal therapist, and he also. I mean, like, to me and you, this sounds normal. Why wouldn't you want to see the best in someone, right? But therapy, usually we're trying to fix people's problems. Or usually they have some deficit. I'm depressed, I'm anxious, I can't do this, I can't do that. So
sounds like validation from what the way you described it first, right? This guy validates a lot, which some people have said. You and I have worked together for a long time. That you're kind of like the validation the king.
Yeah, well, I wouldn't say validation king. And the funny thing is with these words in English, you have all these different psychotherapies, and they'll use similar words or the same word to mean slightly different things. And for the most part, none of this stuff matters, right, around those nuances. But when you start to get into the nitty gritty where you're trying to figure out, hey, do I use harm reduction with this person? Hey, do I use motivational interviewing? Hey, do I use dialectical behavior therapy skills? Hey, does this person have trauma? Do they need a trauma treatment? Hey, do I use case management? Do I do more goal setting, more aggressive goal setting? I think there's value in knowing the pros and cons of the different approaches and being able to shift with intention based on what the person needs at the time. And we both know from friends, family, patients, sometimes what the person thinks they need may not be exactly what they need. In fact, we may think about ourselves, right? Sometimes what 100%. We think we need is not what we need. And sometimes we need somebody to be a bit more firm. But yeah, so that's sort of some of the background around motivational interviewing. And I'm so glad that you're doing this course, because you get to hear from the guy that developed it, right?
Yes.
Because in 40 years or so, he won't be around. I mean, his videos will be there.
Yes.
But he won't be around to have those in-person.
Well, I'm so encouraged that he's still alive. Because it was sort of folklore in the story, because I've heard his name so many times for so many years from you, that now I get to actually put a face to it and see his little New Mexico tie. He's from New Mexico as well, is he?
Yeah.
Okay.
Yeah.
Well, right, because I know you always said the workshops were in New Mexico, but he wears this sort of Aztec shirt, and it's very trendy looking, little kind of New Mexico
Albuquerque is very interesting because there's a very interesting therapist in psychology and psychotherapist that developed from.
Now, you went down there yourself?
Yeah, so I did go down there myself. I went down there for a couple of. I went down there more for the Echo. So the Echo also developed there. So the education thing.
Have you met Bill Miller?
Only when he came to CAMH. So he came to CAMH maybe 10 years ago. He had a workshop there.
Okay.
And so I attended there when he was there.
Were you like a little fanboy?
I thought I would be, but he was so humble and had such humility. Like sometimes you want your gods to be gods. I don't know how to explain it. He presented himself as so human, but it was really nice to see him. And I think a lot of the philosophy I've kept with myself. And you see it, right? Because every time I give a talk, I make sure I try to add a couple of snippets in, so anyone in the audience maybe thinks about, or maybe even realizes, if we're lucky, that they could do some of the stuff that I do.
Yeah, and one of the common questions we get at talks that we've done is how, after you've introduced it, people say, how can I learn about this, right? How do I learn about it? And I always remember one of your things is it's not in a book, right? This isn't book learning. It may be in a book, but it's not. That's not the best way of learning it, and it's not the complete way of learning it.
Do you remember what the best way is?
It reflecting, like doing it, recording it, and then having somebody else critique it, which is tough.
Yeah, absolutely. So that's how you get good at it.
Right.
That's how you make sure that you're doing it, right? So once you learn the skill, if you're getting feedback, if you're getting coaching, if you're having recorded sessions where you're being scored, you stay good at it. Because what happens is that if you start doing motivational interviewing, about 6 months after you're done the course, your patients don't always drink less. And what the reason that they suspect is because you start to get it back into the corrective mode, because you know the answers, right? And so someone comes in, initially you're using a lot of MI, you're using motivational interviewing, they're coming up with their own reasons to change. But then 6 months later, maybe you just forget and you go back to your old habits. Like, you got to stop. And it's not always as effective.
So it's a skill you can not necessarily always get better with time. In fact, if you're not perfecting it, you may get worse.
Or if you're not getting feedback. If you're not getting feedback or observed interviews. The way that we want people to learn it is through experiential exercises. So like workshops, right? And so most people in medicine, they go to an hour-long talk. Most healthcare providers, they can learn it, they can memorize it, they can pass a multiple choice test on the content. But in order to do motivational interviewing, I think to do it well, or the way that it was designed, you have to sort of have some of these experiential exercises where you get to feel what that ambivalence is like. And when they're doing these workshops, they usually use real play. And what does that mean? It means like when you're there, you actually pick something that you want to change that you've not changed yet, something that you used to do that you're not doing that you want to do again. And what that allows you to do is really be fully with that ambivalence.
Is that sorry to interrupt, is that kind of the activity where we were standing in a room and going from one side to the other side?
Yeah, that was part of it.
Okay.
That was absolutely part of it.
Yeah.
And so when in motivational interviewing training, they have separate training workbooks that's full of exercises like that. And so you have a small group, you have them come with a question, you have them practice together, or you have these exercises where they move around the room.
Yeah.
And all of them cover a simple component. So for example, that 1 hour talk that covers all the basics of MI, when you're doing a workshop, a 1 day or a 2 day workshop, you take each one of those points, you create an experiential exercise around it, or you use someone else's. The whole MI community is all about sharing. So for example, if you joined Mint, that motivational interviewing network of trainers, or if you got, they share all of their exercises. Just like whereas some of these other therapies, they're very protectionistic, right?
Yeah. Which
you sort of have to be, right? If you want to have a successful business and you don't want someone else to take your idea and all that kind of stuff, right? So they have all these exercises where you have the people do the exercise and then you debrief. You teach a content, you have people do the exercise, and then you debrief. And the whole day is set up that way when they run workshops for motivational interviewing.
Are there workshops available in Canada and commonly now, or has that kind of been shut down with the pandemic and all that sort of stuff?
Well, I mean, I think even before it was hard to find, because with things like cognitive behavior therapy or these other third wave psychotherapies, there's an incentive to create more and more workshops. With motivational interviewing, it's not like it's like this huge brand, right? Anybody can sort of pick up the skill and learn it and teach it. I think you just have to go to that conference where they have for the Motivational Interviewing Network of Trainers, and you could run these training sessions according to whatever certification.
And that's called Mint? Is that what you said?
Yeah, Mint. Okay. Mint, yeah. And so it's always tricky to find a good quality workshop to go to. I think the courses that you're doing are usually quite good. I can't wait to hear about it when you're done it.
Yeah, for sure.
So to hear about what exercises.
Now I've got the motivation to get it done now, right? And to report back on it.
Yeah. Well, I think the other thing that we want to think about is what are the things that they do well? Because the things that they do well in that workshop, we don't need to recreate it. We don't need to cover that content. We don't need to create exercise if people get that experience. But there's going to be some things that are essential to be a good MI practitioner where you don't get that experience from doing an 8-week online course.
Right.
And those are the things that people that want to get better at their craft are going to want to learn and do. And how can we help people pick up those skills?
Right.
Can you imagine if every caseworker could choose when to bring out the MI skill set? It's definitely going to help the patients that they're seeing and serving.
Absolutely. I feel like it's always out with you. Is it not always out? No?
Yeah, so you haven't been to a lot of these trainings yet, right? But I know you've been exposed to some things. And what I find is that the people who do the trainings have completely drank the Kool-Aid of the philosophy they're teaching.
Okay.
And I don't know if that makes sense.
Yeah,
right?
absolutely.
So I don't know if you've done any mindfulness, but what is mindfulness? It's being present. They have this raisin exercise. So you have the raisin, you put it on your tongue, you look at it, you smell it, you have it, and it's like a 10-minute raisin exercise. And when you watch these people who do mindfulness present, they're almost in like that Zen-like state, and they're mindful in how they're existing. When you watch cognitive behavior therapy people present, it's almost like they're very structured, rules, they have an agenda, start point, which is just like the therapy, right? And so for me, it is a big part of what I do. And one of the reasons for me why it's so important is because the most important thing for me is engagement. I want to have that connection with the person. I want them to feel comfortable coming back. And if they know that I see their value, I see their competence, I see their skill, they're going to be more likely to come back to me.
Yeah.
Whereas if I'm lecturing them about things they already know, stuff that are going to be life-saving if they did it, but if it's stuff they know, it could just go wrong. So I always start with an MI approach where I try to build that trust. Now that I think about it, there's some cases where I need more of a harm reduction approach. I need to say, hey, if you need any supplies, they're over here, right? And that's something I've not fully mastered, right? But it might also be the environment. So I'm MI because I like to know what's important to people. I'd like to know what people care about. And it doesn't matter whether it's a patient or a colleague, because there may be some things in the addiction world that could help them. So if it's a patient, once people start talking about what they care about, all of a sudden they eventually realize that, hey, maybe the substance isn't helping. Sometimes it takes a while.
Yeah.
And for colleagues, if I know what they care about and I can tack in a substance use, a skill, all of a sudden every single patient they see is going to be exposed to that skill that person has. Because when people are out in practice, they're so busy, they're so swamped, they're so trained, they don't have time to add extra skills to their practice, right?
Yeah. So I got a deal for you. So maybe I can help walk you down the harm reduction path and in this learning, and then maybe you can help me as I come down the road of this MI and finish my course and check back with you, and we can both kind of walk down these journeys together. How does that sound?
Yeah, no, I think that would be great, and for you, I think it's going to be incredibly important because now you're a clinician, right? You're a caseworker now, and so you're regularly doing intensive case management for many clients that you see and you work with, and what you're also finding, which was I think what was happening when we worked together as well, there are certain patients that have different stories than you do. Right? So when somebody has a similar story, you're like, hey, I get it. Boom, the relationship is there. And when the relationship is there, you can give advice. You can know what to do because there's the relationship and there's the trust that's there. But for the people where they've got a different story, you're going to need some tools and tips to build their trust.
100%.
And MI is a very effective tool to build people's trust. And the only caveat I would add is that you really want to make sure that whatever you do it as authentically as possible. Yes. You do as much with the person's intention, compassion for that person in mind. And the reason that I say that is because with motivational interviewing, what happened before the 3rd edition was written, Bill Miller, he read this book on how to get someone to do what you want them to do in like 7 steps. And it was all MI. And he was really upset because in his mind, he was like, no, this is not a coercive therapy. It's very patient-centered, but it was exactly what they're doing in sales. And so after he read that, they shifted the spirit to also include the word compassion. So it's also compassion for that person in front of you, and hopefully, I think this would work out. But the hope is that by having that compassion, even if you have different goals than the person does for themselves, that's going to help shift you so it's also oriented with what they want for themselves.
Makes sense. Sounds like a plan.
Okay.
All right. Thank you.
That's it?
That's it.
Oh. Okay, I could have talked for a while longer. I thought we were just getting to the meat, but I guess we need more than one session.
We need more than one session. We're not going to get this done in one session. I got to do some learning and come back.
Okay. No,
all right.
I got to see my family.
Okay.